Welcome back, everybody. I hope you enjoyed your lunch break. The next section of our conference will be about the methods of tobacco prohibition. We've already learned something about it this morning, and now we're going to concentrate in depth and in more detail on the ideology, the forces behind tobacco control, smoking prohibition, and also focusing on passive smoking fraud, which is a very powerful tool they use and that has a lot to do with the smoking bans, about which we're talking. We originally had 3 speakers for this section, as my colleague already pointed out. Professor Vos unfortunately cannot attend because of health reasons. I mean, most of you, or some of you probably know that there were attempts to prevent him from attending the conference beforehand, but these attempts were not successful, but unfortunately his health did the job for the antis, but it doesn't mean that he isn't here in spirit. I mean, we have at least the abstract of his speech, and yeah, we will start with that. The abstract of Professor Vos' speech about the health protection and prohibition paradigm then will be read by my colleague on the TICAP BOD, John Gray.
Right, well, thank you very much once again, Christoph. I shall do my best to read this abstract by Professor Vos, which I've only seen about 20 minutes ago. So, Vos says, the health, protection and prohibition paradigm and its devastating effects on creativity in Western and democratic societies. This is what this abstract is about. And it starts off by saying, when the claim to superior knowledge of good and evil lacks justification, the exercise of moral authority of one man over another deteriorates into something which may be called moral tyranny. The subject is then forced to do things in the name of his good, when actually he knows better himself what is good or bad for him. And that is a quote from Geary H. von Wright. The public health community has invaded EU politics and health policy by stressing that health is the overriding value in modern society, and this value should be protected at any cost. Consequently, many protection regimes are set up with smoking ban laws to prohibit passive smoking as their most prominent and paradigmatic example. Many assumptions are underlying this paradigm, e.g., the notion of zero tolerance of risks, a specific set of methodological principles to enact this prohibition paradigm, and a set of biostatistics which reminds us of the old slogan that there are 3 kinds of lies: lies, damn lies, and statistics. The statement, a part of the phrase attributed to Benjamin Disraeli and popularised in the United States by Mark Twain, refers to the persuasive power of numbers, the use of statistics to bolster weak arguments, and the tendency of people to disparage statistics that do not support their positions. In this presentation, however, I want to address it was a brain tumour. I want to address the underlying way of thinking about this health protection and prohibition paradigm which presently dominates EU politics and policies. That is the idea that protection regimes, such as smoking ban laws, are doing good to citizens and social life. In fact, I want to show that such regimes are not only exerting power on citizens leading to social offence, discrimination and paradoxical outcomes, e.g. the fact that in Italy, under present law, one will be penalised in case of smoking in front of a pregnant woman, but being spoken free, there must be smoke free, when letting a child to drowning in the water without help. Sorry, it does make sense in English. But being spoken free when letting a child to drown in water without help. Okay. I want to show that such regimes are based on the idea that a virtuous life is the basic machinery in societal life, as is currently expressed by Western governments and societies, e.g. the Dutch government, which says, working together, living together. This modern form of governmental paternalism is in fact tapping from the wrong human sources, stifling and blocking creativity, communal life and social aspiration. I will draw lessons from the once famous Dutch philosopher Bernard Mandeville, now mostly forgotten and unknown, and the founding father of the Dutch intellectual tradition of tolerance and pragmatism, which had much spreading in Europe, both in the UK, where he lived, and the continent. His main thesis is that the action of men cannot be divided into lower and higher. The higher life of men, e.g. being healthy, responsible citizens who abstain from smoking, eating fat, drinking alcohol, etc., is merely a fiction introduced by philosophers, public health experts and rulers to simplify government and the relations of society. In fact, virtue, which he defined as every performance by which man, contrary to the impulse of nature, should endeavour to benefit to others, or the conquest of his own passions out of the rational ambition of being good, is actually detrimental to the state in its commercial and intellectual progress. For it is the vices, i.e. self-regarding actions of men, which alone, by means of interventions and the circulation of capital, emotional, social and economical, stimulate society into action and progress. Societies possessed of all the virtues, including the smoke-free and alcohol-free or a fat food-free life, blessed with content and honesty, will fall into apathy and paralysis. Thus, private vices are public benefits. It is time to remember the lessons of the famous Dutch philosophers such as Mandeville and before him Erasmus and Spinoza as an inspiration for a new EU politics and policy. That is by Professor Rein Vos, University Professor of Theory of Health Sciences and the Chair of the Department of Health Ethics and Philosophy at the Faculty of Health, Medicine and Life Sciences at Maastricht University. From 1982 to 1997, he was staff member of the Social Pharmacy, Pharmacopedia, I can't pronounce that one, how's it pronounced? And Drug Policy Unit and Special Professional History of Drug Research and Pharmacy at the University of Dublin. I'm sorry my reading wasn't perfect, I saw it 20 minutes ago, and, but there we are, that's the contribution from Ross.